You're about to discover what separates men who live independently into their 80s from those who become a burden to their families. What you learn in the next 15 minutes could save you from the most preventable cause of stroke in American men over 60. This isn't another lecture about eating vegetables or walking more. This is about a 64-year-old construction foreman who knew exactly what he needed to do to stay healthy and chose not to do it. Frank Martinez, 64, from Phoenix, thought he was smarter than his blood pressure medication. He took his pills when he remembered, skipped them when he felt fine. On a Tuesday morning in October, Frank couldn't move his left side. The stroke that followed was completely preventable. Every day you ignore your blood pressure, you are gambling with your independence. Unlike Frank, you might not get a second chance. I'm Dr. Ellis Grant, family medicine physician with over 30 years treating stroke patients just like Frank. Welcome to Health SOS, where real people share real warnings that could save your life. Frank's about to tell you exactly why he thought those little white pills weren't worth the trouble and why he'll never make that mistake again. Frank, I want to take our listeners back to before that Tuesday morning when everything changed. You'd been diagnosed with high blood pressure 3 years earlier, but you had your own ideas about taking medication, didn't you?
Dr. Grant, I'm not proud of this, but yeah, I thought I knew better. I'm a construction foreman. Been managing crews for 30 years. When I took those pills every day for the first few weeks, I felt terrible. Tired, dizzy, just not myself.
So you made an executive decision.
Exactly. I figured, why feel lousy every day when my blood pressure was only a problem sometimes? I started taking the pills only when I felt my pressure was up, when I had a headache or felt stressed. The rest of the time, I felt fine. So why fix what wasn't broken?
Let me stop you right there, Frank. What you just described is exactly what makes high blood pressure so dangerous. Unlike a broken bone that hurts and demands attention, elevated blood pressure rarely causes symptoms you can feel. Your blood vessels are taking a beating 24 hours a day, but your brain isn't sending pain signals. Every day you skipped medication, you were playing Russian roulette with your brain cells.
I wish someone had explained it that way. My doctor just said, take these every day, but never made me understand what was happening inside my body.
Tell me about your father's influence on this decision.
My dad lived to 89 and never took a prescription medication in his life. He used to say, Frank, your body's tougher than any pill some doctor can give you. I believed that. Plus, I'd been doing construction work since I was 22. My body always told me when something was wrong.
And Maria, your wife knew about your creative medication schedule?
She suspected. Every morning, she'd set out my pill with my coffee and say, Frank, just take the damn thing. I'd usually brush her off, tell her I was feeling good. Some mornings, I'd take it to stop her nagging, but most days, I'd wait until she left for work and put the pill back in the bottle.
So you were actively deceiving the person who cared most about your health?
Yeah, and I justified it by telling myself I was managing my health my way, taking medication when I needed it, not when some schedule said I should. I had no idea what was building up in my brain during those 3 years.
If you're taking blood pressure medication inconsistently right now, what Frank's about to tell you will change everything. Because blood pressure medication isn't like aspirin for a headache. It provides continuous protection against the silent damage that leads to stroke.
Dr. Grant, if I'd understood that my blood vessels were getting destroyed even when I felt perfectly fine, everything would have been different.
What Frank didn't know, and what his brain scan would later reveal, is that every skipped pill was setting up the perfect storm. Frank, tell us about that Tuesday morning when your body finally started screaming loud enough for you to hear it.
That morning, Dr. Grant, I learned that sometimes when your body finally decides to tell you something's wrong, it's already too late to fix it easily. That Tuesday morning started like any other, Dr. Grant. I woke up around 5:30 a.m., same as always. Maria was still asleep, and I was planning to get an early start on a job site inspection. But when I tried to sit up in bed, something felt off.
Describe off for us, Frank. What exactly did you notice first?
My left arm felt heavy, like it had fallen asleep, but not quite. When I tried to reach for my phone on the nightstand, my hand wouldn't grip it properly. I kept dropping it. I thought maybe I'd slept on it wrong, Happens when you get to be my age.
So you weren't immediately alarmed?
Hell no. I've been doing physical work for 40 years. I know what a pinched nerve feels like. I figured I'd walk it off, maybe do some stretches. I managed to get out of bed, but when I stood up, I had to grab the dresser to keep from falling over.
At what point did you realize this wasn't a pinched nerve?
When I tried to walk to the bathroom and couldn't walk straight, I kept veering to the left like I was drunk. My left leg felt like it belonged to someone else. That's when I started to get scared. But I still didn't want to wake Maria up and worry her over nothing.
Frank, what you were experiencing was your brain losing control over the left side of your body. When blood flow to the motor cortex gets disrupted, which is what happens during a stroke, the electrical signals that control muscle movement can't get through properly. Your brain was sending the commands, but your muscles weren't receiving them.
I made it to the bathroom, barely, by holding onto the wall the whole way. When I looked in the mirror, that's when I knew something was really wrong. The left side of my face was drooping. Not a lot, but enough that I could see it. I tried to smile, and only the right side of my mouth moved.
That facial drooping is a classic stroke warning sign. Did you know to look for that?
I'd heard of it, but I kept thinking, this can't be a stroke. I'm only 64. Strokes happen to old people, sick people. I work construction. I'm tough. So I splashed cold water on my face, thinking maybe that would snap everything back to normal.
How long did you spend trying to fix yourself before calling for help?
Too long, Dr. Grant. Way too long. I spent maybe 20 minutes doing facial exercises, moving my arm around, trying to convince myself this was temporary. I even tried to shave with my electric razor, but I couldn't control it properly. That's when Maria woke up.
What was Maria's reaction when she saw you?
She took one look at me and said, "Frank, what's wrong with your face?" I tried to tell her I was fine, just tired, but when I spoke, the words came out slurred. Even I could hear it. Maria went from sleepy to terrified in about 2 seconds.
Did she immediately recognize what was happening?
She's smarter than me, Dr. Grant. She said, "Frank, I think you're having a stroke. We need to call 911 right now." But I fought her on it. I actually told her I'm not going to the hospital because I'm a little dizzy. Can you believe that? I was having a stroke and I was arguing about going to get help.
This resistance to seeking emergency care is incredibly common, especially among men. There's often this belief that symptoms will resolve on their own, or that seeking help is somehow admitting weakness.
That's exactly it. I kept saying, "Give me an hour, I'll be fine." But Maria wasn't having it. She grabbed her phone and started dialing 911. I tried to take the phone away from her, but my left hand wasn't working right, and I nearly fell over trying to reach for it.
So Maria made the call despite your objections.
Thank God she did. While she was on the phone with the dispatcher, I tried to prove I was fine by walking across the bedroom. I made it about 3 steps before my legs gave out completely. I had to sit down on the floor because I couldn't trust my body to hold me up anymore.
At that moment, what was going through your mind?
Pure fear. For the first time, I understood that I wasn't in control of my own body. This thing, whatever it was bigger than my willpower, bigger than my toughness. I looked at Maria, and she was crying while she talked to the 911 operator. That's when it hit me. I might be dying, and it was my own damn fault.
The paramedics arrived within 8 minutes. What condition were you in when they got there?
I was sitting on the bedroom floor in my underwear, drooling without realizing it, and I couldn't move my left side at all. The paramedic took one look at me and said to his partner, "We've got a stroke in progress. Let's move."
Before we continue with what happened in that ambulance, I need to pause here and explain to everyone exactly what was occurring in Frank's brain at that precise moment, because understanding this could save your life or the life of someone you love.
Dr. Grant, when you see those brain scans and understand what was actually happening while I was sitting there arguing with Maria.
While Frank was sitting on that bedroom floor arguing with Maria, his brain was under siege. When blood pressure remains uncontrolled for years, it creates weakened spots in blood vessel walls throughout the brain. That Tuesday morning, one of those weakened vessels in Frank's motor cortex finally gave way. Blood was pooling where it didn't belong, and brain tissue was dying by the millions of cells every minute.
I had no idea anything that serious was happening. I just thought I was having a bad morning.
The ambulance ride was a blur for you, wasn't it?
Completely. I remember them putting me on a stretcher and Maria climbing in beside me, holding my good hand. She kept saying, "Stay with me, Frank. Stay with me." I wanted to tell her I wasn't going anywhere, but I couldn't get the words out right.
At the hospital, what was the first thing the emergency team did?
They rushed me straight to get a brain scan. A CT scan, I think they called it. The ER doctor said they needed to see what type of stroke I was having before they could treat me. I remember thinking, type? There are different types?
There are indeed. About 87% of strokes are ischemic, caused by blood clots blocking arteries to the brain. The other 13% are hemorrhagic, caused by bleeding in the brain. The treatments are completely different, which is why that scan was so critical.
They had the results within maybe 20 minutes. That's when Dr. Peterson, the ER doctor, came over to my bed with this serious look on his face. He said, "Mr. Martinez, you've had what we call a hemorrhagic stroke. A blood vessel in your brain has ruptured."
How did you react to that news?
I think I was still in shock. I kept thinking, this can't be real. This happens to other people, not to me. But then Dr. Peterson said something that hit me like a truck.
What did he tell you?
He said, "Mr. Martinez, your blood pressure when you arrived was 240 over 160. That's stroke level high. This could have been completely prevented with proper blood pressure management." When he said that, I felt like I was going to throw up. Not from the stroke, from the realization of what I'd done to myself.
Frank, let me put those numbers in perspective for our listeners. Normal blood pressure is less than 120 over 80. High blood pressure starts at 130 over 80. Frank's blood pressure of 240 over 160 was nearly double what we consider dangerously high. At those levels, the force of blood against vessel walls is so intense that rupture becomes almost inevitable.
Dr. Grant, that's when they showed me the brain scan. I couldn't really understand what I was looking at. But Dr. Peterson pointed to this dark area and said, "Ditty, this is where the bleeding occurred. This is the damage."
What was going through your mind when you saw that image?
I stared at that scan, and all I could think about was every morning I'd put that pill back in the bottle. Every time I told Maria I felt fine. Every time I convinced myself I knew better than the doctors. I was looking at proof that I'd been slowly destroying my own brain for 3 years.
Did the medical team explain the connection between your medication noncompliance and the stroke?
Dr. Peterson was pretty direct about it. He asked me if I'd been taking my blood pressure medication as prescribed. When I told him the truth, that I took it maybe half the time, he shook his head and said, "Mr. Martinez, if you'd been taking your medication consistently, you almost certainly wouldn't be here today."
How did Maria react when she heard that?
That's the part that still tears me up, Dr. Grant. Maria was standing right there when the doctor said it. She didn't yell or say, "I told you so." She just started crying. Not angry crying, heartbroken crying. She looked at me and said, "Frank, why didn't you just take the pills? Why didn't you just listen?"
What did you say to her?
I couldn't say anything. My speech was still messed up from the stroke, but even if it wasn't, what could I say? I'm sorry I was too stubborn to take a pill that could have prevented this. I'm sorry I thought I was smarter than medical science. There were no words for how stupid and selfish I felt.
The stroke affected the right side of your brain, which controls the left side of your body. What did the doctors tell you about recovery?
They said I'd need months of physical therapy, speech therapy, occupational therapy. They said I might get most of my function back, but it would take time and hard work. The neurologist told me that if I'd gotten to the hospital even an hour later, I probably would have died.
Frank, I want you to tell our listeners what you learned about the difference between the stroke you had and the stroke you could have prevented.
Dr. Grant, here's what nobody tells you about having a preventable stroke. It's not just about the medical consequences. It's about lying in that hospital bed, knowing that every single thing that's happening to you, the paralysis, the speech problems, the fear in your wife's eyes, all of it could have been avoided if you'd just done one simple thing every day.
And that simple thing was?
Taking a pill that cost $2.30 of my time every morning. That's what stood between me and the worst day of my life. $2.30.
What Frank discovered in that hospital room was the devastating truth about preventable strokes. But what he learned next about fighting his way back and making sure this never happens again, that's where his real story begins. Frank, after that devastating revelation in the hospital, you made a complete 180-degree turn in how you approached your health. Tell me about the promise you made to yourself and Maria.
I was lying in that hospital bed, barely able to speak, watching Maria cry because of my stupidity. I made a decision right there. I was never going to put her through this again. Never. If I was lucky enough to recover from this, I was going to do everything exactly like the doctors told me.
What did doing everything exactly look like in practical terms?
The first thing I did when I got home after 2 weeks in the hospital was throw away my old medication bottles and start completely fresh. Maria and I went to the pharmacy and bought one of those weekly pill organizers, you know, the ones with compartments for each day of the week.
So you involved Maria in your medication management from the beginning?
Absolutely. I told her, "Maria, I screwed this up for 3 years. I need your help to make sure I never screw it up again." Every Sunday night, we sit together and fill up that pill organizer. She double checks that I've got the right pills in the right compartments. It's become our routine.
What about the daily routine? How do you ensure you don't forget?
I take my blood pressure medication every morning at exactly 7 a.m. with my first cup of coffee. I set an alarm on my phone, and if for some reason I'm not home at 7, I stop whatever I'm doing and take it right then. Maria has backup alarms on her phone too, just in case.
That level of redundancy shows how seriously you're taking this now. But let's talk about the side effects that originally made you want to skip the medication. How do you handle those now?
Dr. Grant, here's what I learned. Those side effects I hated so much. The fatigue, the dizziness, they were nothing compared to to lying paralyzed in a hospital bed, watching my wife wonder if I was going to die, nothing. I'd rather feel a little tired every day than put Maria through that hell ever again.
Have you found ways to manage the side effects better?
My doctor switched me to a different blood pressure medication that doesn't make me as dizzy. He said there are dozens of different options, and if one doesn't work well for you, you try another. I just never gave him the chance to find the right one before because I kept lying about taking it.
What about the physical recovery? The stroke affected your left side significantly.
The first month was brutal. I couldn't dress myself, couldn't shave properly, couldn't even hold a coffee cup steady with my left hand. Maria had to help me with everything. Bathing, eating, getting to the bathroom. I felt like a child, and I hated every minute of it.
That must have been incredibly frustrating for someone who'd been physically independent your entire life.
It was humiliating. But every time I got frustrated with physical therapy or wanted to give up on an exercise, I reminded myself, this is what you get for being too stubborn to take your medication. This is the consequence of your choices. That anger at myself became my motivation to work harder.
How much function have you recovered?
After 6 months of intensive therapy, I got about 80% of my left side function back. I can walk without assistance now, though I still use a cane when I'm tired. My speech is back to normal. I can't do heavy construction work anymore, but I can live independently and take care of myself.
That's remarkable recovery. What role did medication compliance play in preventing another stroke during this vulnerable period?
My doctor explained that after you've had one stroke, your risk of having another one is much higher. The only thing standing between me and stroke number 2 was taking my medication exactly as prescribed. So every morning when I swallow that pill, I'm not just taking medicine. I'm keeping a promise to Maria that I'll never put her through this again.
Frank, let's talk about the family impact. How has this experience changed your relationship with Maria?
In some ways, it's made us closer. Maria sees that I finally get it, that I understand how serious this is. But I also know I've broken some trust. For 3 years, I lied to her every single day about something that could have killed me. She forgives me, but I don't know if she'll ever completely trust me to take care of myself without her watching.
Do you blame her for that lack of trust?
Hell no. I proved I couldn't be trusted. Now I have to prove I've changed, and that takes time. The daily pill routine, the blood pressure monitoring, the regular doctor visits. It's all part of rebuilding that trust.
You mentioned blood pressure monitoring. What does that look like now?
I check my blood pressure every morning after I take my medication and every evening before dinner. I write the numbers down in a log book, and we take it to every doctor appointment. My target is less than 130/80, and I'm usually right around 125/75 now.
That's excellent control. How does it feel to see those numbers consistently in the healthy range?
It feels like I'm finally doing what I should have been doing all along. Every time I see a reading like 125/75, I think about what my blood pressure was the morning of my stroke, 240/160. Those numbers remind me every day why I can never go back to my old ways.
Frank, what would you say to men who might be listening right now and recognizing themselves in your pre-stroke story?
I'd say this: your pride isn't worth your wife's tears. Your stubbornness isn't worth 6 months in a wheelchair. And your idea that you know better than doctors isn't worth the risk of leaving your family without you.
Frank, 18 months after your stroke, let's talk about the real impact this had on your family. We touched on Maria's reaction in the hospital, But what was the full cost of your decision to skip medication?
Dr. Grant, the financial numbers alone should scare any man straight. My 2 weeks in the hospital cost $47,000. 6 months of rehabilitation therapy cost another $23,000. Even with insurance, we paid $8,000 out of pocket. You know what my blood pressure medication costs per month? $38. I spent more on coffee than I would have spent preventing my stroke.
But money wasn't the only cost, was it?
Not even close. Maria had to take 3 months off work to take care of me. She used up all her sick leave, all her vacation time, then took unpaid leave. We lost about $15,000 in income on top of medical bills. My son Jake drove down from Denver every weekend, missing time with his own kids. My daughter Sarah rearranged her work schedule for my therapy appointments. My whole family's life got turned upside down because I was too stubborn to swallow a pill.
What about the emotional toll on Maria specifically?
Maria aged 5 years in those first 6 months. She barely slept because she was afraid I'd have another stroke in the middle of the night. She went from being my equal partner to being my caregiver. She had to help me dress, bathe, even cut my food. The woman who married a strong, independent man suddenly had to take care of someone who couldn't function alone.
How has your relationship changed?
In some ways, we're closer. She sees I finally understand how serious this is. But I also broke her trust. For 3 years, I lied to her every day about my medication. She forgives me, but I don't know if she'll ever completely trust me to take care of myself without her watching. And honestly, I don't blame her. I proved I couldn't be trusted.
That leads me to what you're doing now. You've become an advocate, speaking to other men about medication compliance.
I speak at senior centers, health fairs, anywhere they'll have me. I can't undo what I did to myself and my family, but if I can prevent even one man from making the same stupid choices, then maybe some good comes out of this nightmare.
What's your core message when you speak to these groups?
I tell them exactly what I'm telling your listeners. We've been taught our whole lives that being tough means ignoring problems, not needing help. But when it comes to blood pressure medication, that mindset isn't tough. It's selfish and deadly. You're not just risking your own life, you're gambling with your family's future.
What resistance do you encounter from these men?
The same resistance I had. I feel fine. I don't like how the medication makes me feel. My dad never needed pills. I hear all my old excuses coming out of their mouths and I want to shake them. So I show them pictures. Me in the hospital with a feeding tube, Maria crying in the waiting room. I tell them, this is what happens when you think you're tougher than high blood pressure.
Let's give our listeners a practical action plan. What should men do today?
First, be honest about your medication compliance. Go to your medicine cabinet right now and look at your blood pressure pills. If that bottle is fuller than it should be, if you've been skipping doses, you are playing Russian roulette with your brain.
What if they're experiencing side effects?
Call your doctor today, not next week, today, and ask about alternatives. Don't suffer in silence, and don't stop taking medication without medical supervision. There are dozens of blood pressure medications available. I just never gave my doctor the chance to find the right one because I kept lying about taking it.
How should they involve their families?
Tell your wife or kids the truth about your medication compliance. Ask them to help you stay accountable. Buy a pill organizer and let them help you fill it. Set up a daily routine. Same time, same place, every single day. It's not weakness to ask for help. It's intelligence.
What about the families listening? What should they watch for?
If your husband hasn't had his blood pressure checked in the last year, make the appointment for him. If you suspect he's not taking medication consistently, have that difficult conversation. Don't wait until he's lying paralyzed in a hospital bed to find out he's been skipping his pills.
Maria has advice for other wives, doesn't she?
Maria tells other wives, don't worry about nagging. Worry about becoming a widow or a full-time caregiver because your husband was too stubborn to take his pills. She says, don't enable their excuses. If you know they're not taking medication, call the doctor yourself. Make the appointments. Drive them there if you have to.
For immediate action, what's the most important first step?
Check your blood pressure. If you don't have a home monitor, go to any pharmacy. Most have free machines. If your reading is over 130/80, see a doctor. If you're already on medication, but your pressure is still high, have an honest conversation with your doctor about compliance.
Frank, what do you want your legacy from this experience to be?
I want to be the guy who was too stubborn to take his medication, paid the price, then used that experience to save other families from the same hell. Every morning, when I take my pill at exactly 7 a.m., I think about Maria and not wanting to put her through another stroke. That pill isn't just medicine. It's keeping my promise to the people I love.
Any final words for the stubborn men who might still be resistant?
Your wife doesn't want to be your caregiver. Your kids don't want to lose their father to something completely preventable. You don't want to spend the rest of your life knowing that every limitation you have, every burden you've placed on your family could have been avoided with a 30-second daily routine. Connect your medication to something you care about deeply, because your pride isn't worth your family's tears.
Frank Martinez, construction foreman from Phoenix, stroke survivor, and now advocate for medication compliance. Thank you for sharing your story and potentially saving lives today.
Thank you, Dr. Grant. To everyone listening, please don't wait until it's too late to make the right choice. Take the damn pills.